I am Dr. Laura Moreno, and in this video, I want to share something that surprises many men when they first hear it. Reducing prostate swelling doesn't always start with medication, supplements, or complicated routines. In many cases, it starts with a very simple daily habit that takes about 30 seconds, but has a real physiological impact when done consistently. This habit is not dramatic. It doesn't promise instant results, and that's exactly why most people ignore it. But from a medical perspective, it directly influences one of the main factors behind prostate swelling: pelvic congestion and chronic tension. To understand why this habit works, you first need to understand what prostate swelling actually is. Prostate swelling is not just about the size of the gland, it's about inflammation, fluid congestion, circulation, and pressure in the pelvic area. Many men focus only on enlargement, but swelling is often functional before it is structural. In other words, the prostate can be irritated, congested, and inflamed long before tests show significant enlargement. And during that phase, symptoms like weak stream, urgency, nighttime urination, and pelvic discomfort begin to appear. One of the biggest contributors to this congestion is chronic pelvic floor tension. Most men have no idea they're carrying tension in that area. It's not something you consciously feel like shoulder tension. It's subtle, constant, and often linked to stress, posture, sitting habits, and breathing patterns. When the pelvic floor muscles stay slightly contracted all day, blood flow in the pelvic area is reduced. Lymphatic drainage slows. Inflammatory byproducts linger longer than they should. The prostate sits right in the middle of this environment. Now here's where the 30-second habit comes in. The habit is intentional pelvic floor relaxation combined with slow diaphragmatic breathing, not strengthening, not squeezing, relaxing. This is the opposite of what many men think they should do. They've heard about Kegels and assume tightening is the solution. But for many men with prostate swelling, the problem is not weakness, it's chronic tightness. A muscle that never fully relaxes impairs circulation, and poor circulation is a major driver of swelling. This habit can be done standing, sitting, or lying down. It takes about 30 seconds. The key is awareness and consistency, not force. Here's what happens physiologically when you do it correctly. When you take a slow breath in through your nose and allow your abdomen to expand, the diaphragm moves downward. This movement gently massages the pelvic organs. At the same time, consciously allowing the pelvic floor to soften reduces pressure around the prostate. On the slow exhale, the nervous system shifts toward a parasympathetic state. This tells the body it is safe to release tension. Blood vessels dilate slightly. Circulation improves. Even short periods of this can interrupt hours of unconscious pelvic tension. Many men live in a constant state of subtle bracing. They hold their abdomen in. They clench without realizing it. They sit for long periods with the pelvis tilted in ways that compress circulation. This creates a baseline level of congestion that the prostate has to live in every day. The 30-second habit doesn't fix everything by itself, but it reduces one of the constant stressors acting on the prostate. What's important to understand is that prostate swelling is not only driven by hormones or age, it's also driven by mechanical and nervous system factors. And those factors respond very well to small, repeated interventions. Another reason this habit is effective is because it counteracts stress. Stress increases cortisol. Cortisol increases inflammation. Inflammation worsens swelling. When you consciously slow your breathing and relax the pelvic floor, you interrupt that chain. This is why some men notice that their urinary symptoms are worse during stressful periods, even if their diet and medications haven't changed. The nervous system is directly involved. This habit also helps reduce urinary urgency. A tense pelvic floor can irritate the bladder and prostate area, sending false signals of urgency. Relaxation reduces that irritation. Many men are shocked when they realize how much tension they were holding once they finally let it go, even briefly. Another key point is that this habit works best when done multiple times a day, not just once. That's why the 30-second duration matters. It's realistic. You can do it in the morning, during the day, and before bed. Doing it before sleep is especially helpful because nighttime symptoms are often worsened by pelvic congestion and stress-related tension. This habit does not replace medical treatment when needed. It doesn't cure infections. It doesn't reverse advanced enlargement overnight, but it creates a better internal environment for healing and symptom improvement. In men with early or moderate symptoms, it can significantly reduce pressure, improve comfort, and make other treatments work better. Another important benefit is that it improves awareness. Once you become aware of pelvic tension, you start noticing when it creeps back in during the day. You catch yourself clenching, and you can release it. That awareness alone changes patterns that may have been present for decades. Many men unknowingly tighten their pelvic muscles when they're stressed, concentrating, driving, or sitting at a desk. Over years, that adds up. This habit is not about perfection, it's about interrupting that pattern repeatedly. What's also important is that this habit has no downside when done correctly. It doesn't strain muscles. It doesn't require equipment. It doesn't interfere with medications. And yet, because it's simple and doesn't feel dramatic, it's often dismissed. From a medical standpoint, that's unfortunate because prostate health improves most reliably when inflammation, circulation, and nervous system tone are addressed together. And this habit touches all three. Now, this is only one piece of the picture. Prostate swelling is influenced by food, hydration, sleep, movement, and daily habits. But this 30-second practice directly targets an area that is almost never addressed in standard advice, and that's why it matters. To really understand how and when this habit makes the biggest difference, it's important to look at how it fits into daily life, what common mistakes prevent it from working, and which signs tell you it's actually helping. Topics we need to continue exploring step by step so this doesn't remain just an interesting idea, but becomes a practical tool you can actually use. When men start practicing this habit consistently, one of the first things they often notice is not a dramatic change in symptoms, but a subtle shift in awareness. They become aware of how often they were holding tension without realizing it. This awareness is not minor. It's the foundation of change. Many men are surprised to discover that they tense their pelvic floor when they're stressed, frustrated, focused, or even bored. It becomes an automatic response, just like tightening the jaw or raising the shoulders. And because it's automatic, it feels invisible. This constant low-level contraction keeps pressure on the prostate and surrounding structures. It reduces blood flow. It interferes with normal drainage. Over time, it contributes to swelling and irritation. The 30-second habit works because it interrupts that automatic loop. Each time you pause, breathe slowly, and consciously allow the pelvic floor to soften, you're teaching the nervous system a different default. You're reminding the body that it doesn't need to stay guarded all the time. This is especially important for men who sit for long periods. Sitting already places pressure on the pelvic area. Add unconscious muscle contraction, and you have hours of reduced circulation every day. That's not something the prostate tolerates well long term. Another key point is that many men confuse relaxation with weakness. They worry that relaxing the pelvic floor will worsen urinary control. In reality, a muscle that can fully relax is a muscle that can also contract properly when needed. Chronic tightness actually reduces functional strength. Men with urinary symptoms often have pelvic floors that are too tight, not too weak. That's why strengthening exercises alone don't always help and sometimes make symptoms worse. This habit restores balance. It's also important to mention breathing technique. The breath should be slow and nasal. Fast or shallow breathing doesn't have the same effect. The goal is to let the abdomen expand gently, not to force air in. During the inhale, you allow the belly to rise naturally. During the exhale, you imagine the pelvic area softening and dropping slightly, not pushing, not straining, just releasing. This may feel unfamiliar at first. That's normal. Most men have never intentionally relaxed this area. The beauty of this habit is that it doesn't require privacy. It can be done anywhere. At your desk, in the car, standing in line, before bed. No one can tell you're doing it. That makes consistency much more achievable. Another reason this habit is powerful is that it improves lymphatic flow. The lymphatic system doesn't have its own pump. It relies on muscle movement and breathing. When the pelvic floor stays tense, lymphatic drainage in the pelvic area slows. This contributes to swelling. Deep, relaxed breathing combined with pelvic relaxation gently stimulates lymph movement. That helps reduce fluid congestion around the prostate. Men often underestimate how much fluid congestion contributes to their symptoms. Swelling isn't just tissue growth, it's also fluid retention in a tight space. Over time, improved drainage can reduce that sense of pressure and fullness that many men describe. Another subtle benefit is improved bowel function. A tense pelvic floor affects not only the bladder and prostate, but also bowel movements. When bowel function improves, pressure in the pelvic area decreases further. Everything is connected. This is why some men notice improvements in both urinary and digestive comfort when they practice pelvic relaxation regularly. It's also worth noting that this habit pairs extremely well with other prostate supportive changes. For example, reducing inflammatory foods lowers irritation, and pelvic relaxation improves circulation. Together, they create a much better internal environment. But even on its own, this habit can make a noticeable difference over time, especially for men with mild to moderate symptoms. The key word here is time. The prostate doesn't change overnight. Swelling builds slowly and it reduces slowly. Expecting instant results sets you up for disappointment. What you should look for instead are small shifts, slightly less urgency, one fewer nighttime bathroom trip, a bit less pressure. These are meaningful signs that the system is responding. Another mistake men make is doing this habit only when symptoms are bad. It's far more effective when practiced before symptoms spike, as a preventative measure. Think of it like releasing pressure from a valve regularly instead of waiting for it to build up. Many men also notice that doing this habit before sleep improves sleep quality. Less pelvic tension means fewer nighttime awakenings and less discomfort when lying down. Sleep quality matters immensely for prostate health. Poor sleep increases inflammation and stress hormones, which worsen swelling. So this simple habit has ripple effects far beyond those 30 seconds. It's also important to address posture during the day. Pelvic relaxation is harder if posture constantly reinforces tension. Slouching, sitting on the edge of the chair, or tucking the pelvis under all increase pelvic floor engagement. Even small posture adjustments make pelvic relaxation easier and more effective. What's encouraging is that this habit gives men something they can control, something they can do without waiting for appointments, prescriptions, or products. That sense of agency reduces anxiety, which itself reduces symptoms. Anxiety tightens muscles. Confidence relaxes them. This habit helps break that cycle. And once men experience even small improvements from something this simple, it opens the door to deeper understanding. They start asking better questions. They become more aware of how daily habits affect their prostate. That awareness is powerful. From here, it becomes essential to talk about common mistakes that prevent this habit from working, how to tell if you're actually relaxing versus accidentally straining, and how to integrate this practice into daily routines in a way that feels natural rather than forced, so it becomes part of life rather than another task to remember. One of the most common mistakes that prevents this habit from working is trying too hard. Many men approach relaxation the same way they approach exercise, with effort force, and intensity. But relaxation doesn't respond to force. In fact, forcing it often creates more tension. If you find yourself pushing, bearing down, or actively trying to make something happen, you're likely doing the opposite of what you want. The goal is not to push the pelvic floor down. The goal is to stop holding it up. This distinction matters. The pelvic floor naturally moves with the breath. When you inhale and the belly expands, the pelvic floor should gently descend. When you exhale, it gently recoils. You're not creating that movement, you're allowing it. Many men accidentally perform a mild strain instead of a release. This can increase pressure and actually worsen symptoms. If you feel pressure or discomfort, that's a sign to stop and reset. Another mistake is holding the breath. Holding the breath activates the stress response. Even if you're trying to relax the pelvic floor, breath holding counteracts the effect. The breath must be slow, continuous, and nasal. A good cue is to imagine fogging a mirror on the exhale, but very gently. This helps slow the breath without force. Another barrier is doing it only once a day and expecting results. The pelvic floor has been holding tension for years, often decades. One short release per day is helpful, but several brief releases spread throughout the day are far more effective. This is why the habit is designed to take only about 30 seconds. It's not meant to be a long session. It's meant to be repeatable. Another common issue is forgetting to do it during stress, which is ironically when it's needed most. Many men only remember when they're calm, but stress is when pelvic tension increases the most. Linking the habit to daily triggers helps. For example, doing it every time you sit down, every time you stop at a red light, or before checking your phone. This makes it automatic instead of something you have to remember. It's also important to address expectations. Some men expect the habit to eliminate symptoms completely. That's not realistic. Its role is to reduce one major contributor to swelling and irritation. It works best as part of a broader strategy. But even as a single change, it can lower baseline tension significantly. Another mistake is stopping too soon. Many men try it for a week, don't notice dramatic improvement, and quit. But prostate tissue responds slowly. What changes first is circulation and nervous system tone. Symptom changes follow later. The men who benefit most are the ones who continue even when the benefits feel subtle at first. It's also useful to understand that symptom fluctuation is normal. Some days will feel better, others worse, even when doing everything right. This doesn't mean the habit isn't working. It means the system is dynamic. Looking for trends over weeks rather than daily changes gives a much clearer picture. Another overlooked factor is hydration timing. If a man drinks very little water during the day and then drinks a lot in the evening, nighttime symptoms will still be problematic, even with pelvic relaxation. The habit helps, but it can't override poor hydration patterns. The same is true for late meals and alcohol. They increase pelvic congestion and nighttime urination. The habit reduces tension, but removing major triggers amplifies its effect. Posture deserves another mention here. Sitting on a hard surface for hours compresses the perineal area. Taking brief standing breaks, adjusting seat position, and avoiding sitting on the edge of chairs reduces constant pressure on the pelvic floor. Pelvic relaxation is easier when mechanical pressure is reduced. Another important point is how to know you're doing it correctly. The signs are subtle. You may feel warmth, a sense of heaviness, or a slight downward release in the pelvic area. You may feel the abdomen soften. You should not feel strain or pushing. If you're unsure, placing one hand on the belly and one on the chest can help. The belly should move more than the chest. This indicates diaphragmatic breathing. Over time, this becomes natural. Another powerful benefit of this habit is its effect on pain perception. Even when swelling doesn't change dramatically, many men report that discomfort feels less intrusive. This is because relaxation reduces nerve sensitivity. Pain is not just about tissue, it's also about how the nervous system interprets signals. A calmer nervous system perceives less threat. This is why some men experience relief even before measurable changes occur. This habit also helps break the cycle of symptom-related anxiety. When a man feels urgency or discomfort, he often tenses more. That tension worsens symptoms, which increases anxiety. Relaxation interrupts this loop. Breaking that loop is crucial for long-term improvement. Over time, men who practice this habit consistently often develop a new baseline. They're less tense by default. They don't clench unconsciously as much. The pelvic area feels less on edge. That baseline shift is what allows other improvements to stick. And once that baseline is established, it becomes much easier to integrate other supportive changes. Recognize early warning signs without panic and respond proactively instead of reactively, which is where real, lasting improvement in prostate comfort and function begins to take shape. Subscribe to the channel and turn on the notification bell so you don't miss upcoming videos where I explain prostate health in a clear, practical, and realistic way. Share this video with someone who struggles with urinary symptoms and doesn't realize how much daily tension affects the prostate. Leave your questions or experiences in the comments, and join me as we continue learning how small, consistent habits can reduce inflammation, improve circulation, and support long-term prostate health without fear or extreme measures.